Authorities are reviewing the use of AstraZeneca's coronavirus vaccine on those 65 years and up. More vaccines are set to arrive in the country, so to speed up the inoculation process, officials are mulling vaccinating first-timers with doses saved as second shots for those already vaccinated. Jang Tae-hyun reports.
South Korea's expert committee on the vaccination program discussed Wednesday whether it's okay to give AstraZeneca's vaccine to older adults. The initial plan was to give AstraZeneca vaccines to senior residents, but those 65 and above were excluded after the Ministry of Food and Drug Safety said such a move should be considered carefully. Its safety and efficacy has been verified, but South Korea said there wasn't enough clinical data for senior citizens. However, a recent study out of the UK showed it's effective for older people, and various European countries have approved it for older people. The results will come out Thursday morning. Previously, South Korea had signed a deal with Pfizer directly to secure enough vaccine doses for 13 million people. From that total, enough doses for 500,000 people will arrive in the country in the 4th and 5th week of March. And in the second quarter, enough Pfizer vaccines for 3 million people will arrive. The AstraZeneca vaccine will arrive via the COVAX facility as well, enough for 345,000 people by this month and 705,000 people by April or May. In the meantime, the country is considering how to move forward with those awaiting their second AstraZeneca shot. According to a text message sent by the Blue House on Wednesday, the country will consider supply and demand and its stock stored for the second shot. As there should be an 8-week gap between the two shots, newly arrived vaccines will be given as a second shot. This will allow the authorities to vaccinate as many people as possible in a short time frame, although that measure will also be decided by the expert committee. The country has been vaccinating people against COVID-19 since late February, and now over 400,000 people have received their first shot, which is around half the priority group to be vaccinated first. Meanwhile, 935 adverse reactions were reported on Wednesday. With 2 more fatalities, both from the AstraZeneca vaccine, a total of 15 vaccine deaths have been reported. Health authorities concluded that there was no causality. But since the vaccination started, a total of 5,700 adverse reactions have been recorded, around 1.3% of the total vaccinated population. Jang Tae-hyun, Arirang News.